Live from Studio 46, this is CBS 2 News.
There are many ways to get rid of cellulite, including creams, ointments, vacuum rollers, laser, and liposuction.
But now the FDA has improved an injection to dissolve it. CBS 2's Dr. Max Gomez explains.
You don't have to be all that vain to hate the dimpled skin, usually around the thighs and buttocks, variously described as looking like cottage cheese or orange peel.
I usually have to try to buy a full bottom base suit because I'm really embarrassed.
It's a sentiment likely shared by millions of women, since some studies estimate that up to 90% of women have at least some cellulite, thought to be hormonally induced. But today, Jeanette is going to do something about it. But first, a science lesson. Cellulite is caused when tiny bands of fibrous tissue connecting the underside of the skin to deeper layers contract, pulling the skin down and allowing fat cells to bulge up, creating the characteristic cellulite dimpling. Now, there's a simple treatment.
We basically do 3 little injections in each dimple, and we do 3 treatments separated by 3 weeks. And we've now seen, since we did the FDA trials 2.5 years ago, women still have seen persistence of the improvement.
It's called QWO, a series of small injections of an enzyme that slowly dissolves the fibrous bands, allowing the dimple to elevate and the fat cells to rearrange. The results, after 2 months or so, led the FDA to approve QWO to eliminate cellulite. So far, it's lasted at least 2.5 years.
Oh, I'm hoping to be able to wear a nice bathing suit and not be embarrassed about showing my buttocks.
So now, what price beauty? Dr. Katz, who did one of the clinical trials, says QWO runs about $2,000 to $3,000 depending on how many dimples get injected. Not cheap, but less than the surgical alternatives. Dr. Max Gomez, CBS 2 News.